map is literally a conceptual model. It's a visual tool. It's a way for us to be able to visualize what the journey looks like in real time. From the perspective, most importantly, of the people who are taking the journey. So that's what we talk about, like when we talk about directly impacted and these voices. We're really trying to hear from the person who's going through the journey what it is like for them, as opposed to what may be written in policy, for example. So let's say the group is patients, then the journey could be a medical visit. What is it like? What happens? What happens before the visit, after the visit? We're gonna get into that. Or prospective students, it could be a college admission. What is that process like? Incarcerated learners, which is what we're talking about today. What does education in prison actually look like for those learners? So why a journey map? Well, the journey map helps us align system design with user needs. I like this illustration. And what we see here is when everybody had an opportunity to walk which way, you see a worn path. And worn paths convey user preferences or tendencies. And design paths are based on these very realities. So now we have a much more efficient way to get from point A to point B. And this was done by analyzing those pathways. Why create a journey map? Because we want to map the experience of the people who are navigating the system. And this is very important to me. One thing that I learned in advocacy since I've been home is that my personal experience was a lot different than what was written in policy or the way that things were supposed to go. So if you had asked a person, maybe in corrections, who wasn't familiar with me personally, what happened at point A and point B, they would have a very different answer than what I would say happened at point A and point B. So this allows us, from direct experience, to view the journey holistically. And we get a chance to look at the journey step by step. We get a chance to understand the journey and the perspective of those individuals taking the journey. We get to identify opportunities for improvement, which is probably the most important principle, and create actionable solutions. And that is what strategic planning is about. We also get a chance to evaluate changes over time, because you get to go back and recreate the journey map at any point in time. That's why I'm so particular about seeing what this journey map is going to bring, especially to my directly impacted people in the room, because we have a huge bit of input to give on this particular thing. So it's also just the last bullet, and a chance to interrogate the system to build an ideal journey map as a North Star for a future state. So we've seen some of that happen already in other states. We have a lot of nationwide partners, and we get to look at certain things that they've done, trace their steps, and see what we can do better, or what is more applicable for our state. So this is an example of a journey map template. So the top line is going to show you the steps of the journey, right? That's going to be your left to right, the horizontal. And then this is going to be your elements of interest. What are the experiences, interactions, goals and motivation, positive moments? This is like analyzing each phase of the journey. So if you remember that top line, this breaks down what that top line actually is. So the phases of the journey are the more general pieces, right? General points of action in the timeline. The steps of the journey, though, will give you more detailed action pieces to what is happening during that particular phase of the timeline. For example, this is the patient's timeline. Let's just go through before the visit. You decide on the need for an appointment, you schedule an appointment, wait and prepare for the appointment. All three of those things are steps in the phase of being before the visit. And in those steps, we get to analyze what was it like? What were the pain points? Which we'll see when we go into the next part of it. Arriving at the facility, during the appointment. But all these are broken down into each single step. I say this a few times by not going through each single step, but hopefully you guys understand what I'm saying. The vertical bar is the bright spots, the pain points. This moment matters because what should we measure? This helps us understand what we're looking at as it relates to the experience when going through each particular phase. For example, a particular phase of corrections would be receiving. What happens at the receiving unit when you're receiving reception? How do they test your academic eligibility or your academic levels? And you would be going through that particular phase and the steps that you go through in that phase. Maybe you take a TABE test. Maybe you take some sort of assessment test. Maybe you need to show your GED. So this is the complete journey map for a doctor's visit. I had planned to go into this, but I won't go so far. Before the visit, we talked about decide on the need for an appointment. So what was that like? Well, the bright spot for this particular person was they got a chance to talk to a trusted helper, right? And this is important. This is the intake moment. And I visualize this as it relates to the educational journey. Am I actually getting a chance to talk to somebody who really cares about my educational outcome? Well, that would matter in how I perceive education going into my prison sentence. Pain points. Well, this particular patient received some incorrect information. That could divert your path greatly. Losing insurance, not registered for VHA. All of these are examples of what patients' experiences were at this particular step or phase in the journey. Sorry, man, it was just. So, phases for higher education in prison and after. So we get a chance to re-envision. I need a paper towel. We get a chance to re-envision the intake to re-entry continuum to prioritize education. Thank you, Executive Director. And like I said, stage one, intake and classification. The Virginia Consensus for Higher Education in Prison is really specifically concerned with the prison experience. So that starts at reception. A lot of folks may get that mixed up. It's not the jail, it's not when you get first incarcerated, it's when you get to prison, the receiving unit. What happens there? So assessments and security level classification, maybe not in that order, but those assessments and security level classifications happens in the receiving unit. And then we have the incarceration period, right? Institutional service plan that you'll work out with your counselor, education and post-secondary that should be worked out with your teachers and principals, social and emotion program that will also be working out with counselors who are developing this treatment plan, and employment training. Stage 3 we'll call reentry. We got a chance to hear Douglas talk about both of those phases, what it was like for him going to this. Continuation of education upon release is a key piece to this. What happens to folks who don't finish their college degree in prison? How do they get to go home and continue their education with a smooth transition? Nicole, I was looking for Commissioner Over. I want her to talk about this. So this is another example of a journey map, buying a product journey map. This is about a customer's journey in purchasing health insurance. Keep using these examples to hopefully give you an idea of what we could create. What kind of journey map could we create? There's no real 100% way that it has to be a certain way. It's kind of like, what can you imagine come up with? What do you think is the most important thing that we need to measure? Especially for my directly impacted folks. What do you think are the things that people wouldn't think of when they think of a journey for a prison education student? It is really something I've encountered quite a lot in this work. Because educators learn to educate. But sometimes educators may not understand the different dynamics of educating in prison. And those of you here that do, you know exactly what I'm talking about. And all those things may need to be somewhere in the journey map. Another college application journey map, which is pretty cool because this is how you apply for college out here, and it is nothing like that in prison. But this is a different way of analyzing what it is like for folks who are trying to find a college for themselves to attend. So, in order to develop a journey map, we co-create with journey takers. That's a big sentence right there. What it means is that everybody that is involved with this journey needs input on this journey map. From a student, to a teacher, to a principal, to maybe even correctional officers and wardens, to be able to understand the map is from their perspective to show their experience, right? It can be written from each individual perspective. So you define the scope and components. Where does the system start? Where does it stop? Past elements to include pain points, bright points, measures, and metrics, but Commissioner Overly, please jump in whenever you want to, because I passed the slide that I was going to pass to you, but she's an expert on journey maps as well. So we build a journey map by collecting info from the users. That's really intentional. That means asking questions. That means respecting points of view. That means listening to people's real lived experiences and figure out how it correlates into meaningful pieces of this journey map. So firsthand experience is the key. Lived experience, y'all. Lived experience, direct experience, the people who were there. So the incarcerated learning journey map. So I'm part of the sustainability working group, and we're going to create a journey map that will visualize the current educational journey of incarcerated learners. And then we're going to identify things that are working well and opportunities for improvement. And from that, we're going to figure out how to solve some of these problems. Active solutions, like real things that will work, that we can do now. We also want this journey map to serve as a point of reference for stakeholders and a baseline to evaluate the impact of future changes. It has a lot to do with what we talked about with House Bill 1041 and that information that we want to use to be able to inform legislation that will come in 2027. Thank you.